Good afternoon, everyone. Welcome as you start coming on in. I'm Nick Barrow, joined by my good friend, Dr. Eric Lullove, and soon to be joined by his good friend and someone I'm very excited to meet, Dr. Angela Rasmussen, or Doc Angie. Eric is going to introduce her here in a couple minutes, and then we'll pull her on once she's available. Before the show, the last thing I heard before we went live was Eric saying Saskatchewan time got me. And so we're gonna have Doc Angie here in a couple minutes. Eric, how are you, my friend?
I'm fantastic, my friend. How are you?
I'm doing I'm doing well today. I am doing well today. Had a really good conversation with the Angry Male Vet not too long ago, where we were talking masculinity, better humaning, getting out to vote, and the actions and what it's like to, what it feels like to vote and to participate in civics, and how to let yourself enjoy that feeling of positivity, and what it's like to go touch grass and actually meet people in real life, and do those things in real life, and what it does for you. How are you doing today?
I'm good. So we had a pretty big primary day here yesterday. On Tuesday here in Florida, and unfortunately, our two good friends of my relationships here within Substack, John Lencioni in Florida 13, which is Pinellas County, and then everybody who's watched the interviews with me with my friend Victoria Doyle, who fell short against Lois Frankel, who's a 7-term incumbent in my county, who's going to be turning 80. So, the thing and turnout was very low here in Palm Beach County, just because it's Lois is on the ballot, because she's such a, it's like kind of like an automatic. It's like, it's that people have the name recognition of the incumbency, which is why term limits are so important. I mean, no U.S. congressman, anybody in elected office should be there, for more than 12 years. I mean, I just think 12 years is enough as a sitting U.S. congressman, or 2 terms as a U.S. senator. I think that's enough for public service. And listen, Victoria I was at the campaign party with her and her team in Lake Worth Beach on Tuesday night, and I posted her. I posted her concession speech. She's just very magnanimous, and she's very humble, and she's just she'll be the front runner for 2020 if she wants the seat. But I will say 2 things. What she was able to accomplish in her race on Tuesday is something that never has happened to Lois Frankel ever. She made Lois spend almost $2 million of her PAC money and her fundraising money to defend the seat, which she's never had to do in 14 years. And, Victoria got 23% of the vote, which almost doubled that of any other previous challenger to Lois. So I think, even though Lois won 73% of the vote, Tuesday, it was 57,000 ballots, and it's a plus 24 district. So I think the message is being sent. I think they're getting it, and congratulations to Angie Nixon for beating Alex Colonel Vindman in her election run. So it's Florida's they elected a former Republican to be the Democratic nominee for governor for the state of Florida, and David Jolly, and congratulations to the representative, the congressman, for his win on Tuesday. So he'll be running against Byron Donalds. And then and congratulations to Angie Nixon for, so Florida elected a DSA borderline left progressive senatorial candidate to run against Ashley Moody, and a former Republican, moderate conservative, kind of liberal, kind of a moderate conservative to be governor. It's Florida's like 3 different states, right?
Florida's a weird place. I love Florida, but it's a weird place.
It's a very weird place.
It's a weird place. But we've got 2 doctors in the house today.
Yeah.
So, Eric, do you want to introduce our guest this morning?
I would love to.
Bring her on today, or do you want me to bring her on as you're introducing her?
I think we should bring her on as she's getting out of Saskatchewan time, and
Well, so, she's in the background with us. So
okay. We can bring her in, and then I'll do the biography, and I'll embarrass her a little bit.
Good. All right. Doc Angie, it's wonderful to meet you and have you on with us today.
It's really good to meet you too, Nick. And I have to apologize because Saskatchewan time did get in my way. They are freedom-loving Canadians in this province, and they don't like things like time zone changes or daylight savings time. So I'm always like an hour off, and I'm often an hour late. And so today you're getting au naturel Angie. I hadn't put my makeup on yet.
I haven't put mine on either, so
I'm
both.
Yeah, I just did
We're
my
all
toner
even
and
here.
my facial stuff this morning, so I'm the only one that kind of like.
You didn't put as much eyeliner on as JD
Angie,
Vance
thanks so
does,
much
though.
for coming on today. I listen. You and I have been colleagues and friends for a number of months now. We met through Substack, and we always had great dialogues. And we have, and I truly enjoy our collegial relationship that we have. And for everybody that does not know who you are, so let me introduce everybody to Dr. Angela Rasmussen. She is a PhD virologist. She's a professor at the University of Saskatchewan. Previously, I believe, at University of Washington, I believe.
I was at, there and at Columbia, actually, in between.
And at Columbia, correct. So, but what Angie's really known for these days is she is the science chair of the Save America movement and is doing a lot with our friends Dean Blundell and Steve Schmidt on that level. Angie's back and forth across the border and has been a proponent against the ACIP committee changes, the vaccine changes that are being done at CDC, and a lot of the things that this administration and a lot of what RFK Jr. has been doing to our health system and our science systems, and what Russell Vought attempted to do with the OMB with some of the, and thank God that didn't go through, and just a lot of the changes that Angie and I deal with on a policy side that does not always filter down to the American people. We're on the front lines fighting this stuff. Me on the healthcare policy side, and Angie doing it on the virology laboratory science end. So here he is, and everybody here's Dr. Angela Rasmussen with us front and center in Diogenes today. So thanks for joining us today.
Well, thanks so much for having me. I mean, I really enjoy our collegial relationship too. Eric likes to call me when he's like going to the farmer's market or something and has like science or healthcare issue to like vent about.
Yeah.
And I think we really kind of look at two different sides to the same thing. You know, I also do look at a lot of clinical and public health policy, just because even though I'm not a clinician, I'm also the co-editor in chief of the journal Vaccine. So it's sort of part of my job to keep an eye on all these vaccine policy changes. And, you know, I don't blame people. When I talk to you, Eric, like you talk about the healthcare system, and even though it's like science adjacent, it's completely unfamiliar to me. And often it's really boring, you know, because it's all this policy stuff about Medicare Part D and like all of these things that most people just don't have any idea how to deal with. And it's the same thing on like the public health policy side of things. And that's by intention. And this is why I was really glad to come talk to you about this, Nick, because I know that you've really been paying a lot of attention on the effect that this is having on like American health. And I mean, I really think that all of these policy changes are meant to be boring, because they're actually really effective. Like they are effective in preventing people from getting vaccines. They're effective at preventing people from getting access to healthcare. And they're very effective at like having people not really fight back, because who wants to talk about policy number, blah, 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 or this part of the Code of Federal Regulations. And it's just really boring for most people unless it's something that's really affecting their lives. And the problem with a lot of the health stuff is that it will profoundly affect people's lives, but not immediately. So people can't actually see the damage while it's being inflicted. So I really, really appreciate having this opportunity to come on and talk about it with you guys, because I know you guys have really been digging into different aspects of this than me. It's all important.
And thank you. And I'm really glad you're here with us. Before we get into any real discussion, we have a great initial question for you in the chat, which is there a centralized website or place where people can find what your expertise and what you discuss?
Yeah, I mean, they can definitely go to rasmussenretorts.substack.com, which is my Substack newsletter. And I talk about a lot
Make it longer.
What's that? Make it longer? Yeah, I know. So, you know,
I hit Eric.
That's what happens. That's what happens when you make
fun of kicking Eric off the chat here.
Get out of here, Eric. Like you need to learn how to spell rasmussenretorts.substack.com. No, I thought I was being very clever 6 years ago when I started my Substack and like didn't write anything for 6 years. And, there's this Republican, like highly right wing anti-vax polling firm called Rasmussen Reports. So I'm like, oh yeah, I talk back like Rasmussen retorts. It'll be great. And now I'm just like, shit, my last name is 9 letters long. Substack there. I'm too lazy to like change it to just one URL. It's awful.
I like you're just running with it, Angie. Like you just kind of just running with it, and it's
you got to run with it, right?
Yeah.
And so, I'm really excited to have this conversation because there's a lot. I'm looking forward to what we can talk about today because especially over the last few weeks, Eric and I have been talking a lot about the public health side and the impacts that RFK Jr. and the anti-vax, or as we are now calling it, the gene pool management government, because we got kicked off of, I got a warning on TikTok because we said eugenics and they don't like that word over there. So we're calling it gene pool management so that they're less likely to kick us off of TikTok for clips.
I already know what Angie's thinking. I already got something that she's already formulating in a response in her head. You can just see it.
I love it.
I don't understand how eugenics became a bad word. Like it's an accurate word. But you know what? I got in trouble for saying the F word too many times, both telling fascists to fuck off, but also calling people fascists, even though they are.
Well, I like to say words mean things. And when we use the right words at the right times, they mean really important things. Talking about eugenics and or gene pool management is really important. Calling people fascists when they are being fascists is really important, and not using it as hyperbole, but using it as a statement of fact. And I'm a parent, and I've got 2 young kids, and I live in Arkansas. I live in the South, and I live in a place where gene pool management is probably like a standard policy more often than not. And they are trying to hurt our children in various ways. And one of those is with these new vaccine mandates to split the MMR and other vaccines and loosen restrictions and requirements. And I was reading a report I think it was this morning or the other day, that vaccine coverage for new students is at an all-time low, especially in states like Arkansas and Florida and those in the South. What can we do as parents? What does this impact really mean for parents? And what can we actually do?
Yeah, I mean, this is exactly why this executive order that just came out is so insidious, and I actually was finishing a Substack article that I was going to promote on here, but I still will. It'll be out right after this episode because of Saskatchewan time. But it's kind of explaining the implications of this executive order. And the main thing that people and parents especially should know about this thing is that they can safely ignore it. And they probably should. But if they engage with it, there's some stuff they should know about it. First of all, the president does not have the power to make immunization recommendations at all. So like the whole thing is void because federal law actually states that it is the Advisory Committee on Immunization Practices that has to make vaccine recommendations based on evidence. That's run through the CDC. The CDC director then has to approve those. Now, a new CDC director just started, but the ACIP is not meeting because it was stayed by a federal judge in March due to the AAP's lawsuit, or the American Academy of Pediatrics lawsuit against Kennedy. And the reason for that was the judge ruled that effectively the ACIP, which was composed entirely of anti-vaxxers almost, there's a few non-anti-vaxxers on there, but most of them are bad people acting in bad faith that were put there by Kennedy. And the judge declared that since their appointment, no decisions have been valid. So all of the stuff that they did last year to vaccines is now out the window, and we're back to using the 2025 schedule, which was developed by the actual ACIP, who are vaccine experts, and parents can rely on those. So that's one thing I do want to tell people. If you're confused about which vaccines you should get for your kids, go to the CDC's website, actually. And I don't always say this about vaccines, but in this case, I do, because the current vaccine schedule that is on there is one that has been developed based on evidence. So parents can feel confident using that vaccine schedule for their kids. Now, the thing about this executive order, as you pointed out, Nick, is that it follows on Trump's insane press conference from last year about Tylenol, where he was.
Wait, which insane press conference?
Yeah, you got to be more specific. Which insane? Oh yeah,
there's been maybe, I think there's only been like, I think 200 or 300.
They all are, but this one just sticks out to me because Trump was screaming, break it up. He was telling this story about babies frying and this beautiful baby that like was boiling up and like had a 108-degree fever and stuff, like all this just made up stuff that Trump was saying. And I remember when he started screaming, break it up, I was like, oh my God, that's how they're gonna shit can the MMR. Because the MMR vaccine, the measles, mumps, rubella vaccine, which is, by the way, 97% effective, has been administered to billions of people and is very safe. So you should absolutely get that vaccine for your kids and yourself if you haven't gotten it. But the MMR vaccine has been used since 1961, was when it was combined.
55 years of evidence-based vaccine mandates.
That's correct. And, Kennedy, the whole purpose of making it monovalent, which is what it's called when you split it up into 3 different shots instead of the combined shots, is you get 6 shots instead of 2 for your kids. But there's no monovalent vaccines that are currently licensed by the FDA. So Trump has ordered Kennedy to make these available by November. There are no clinical trials for these things because they discovered in 1961, and as Eric pointed out, have all the evidence since then that they work just fine as a combined shot, and that's what everybody wants. So no manufacturer is going to make monovalents because we don't need them, and there's literally no demand for them.
And the process, because it's so ancient science, right? That they literally would now have to refile with the FDA under a new drug pathway.
They'd have to do a new clinical trial.
They have to do a phase 1 proof of concept trial. They have to do a phase 2 laboratory trial. Then they have to do the phase 3 clinical trials, which will have to involve well over 25,0んpeople.
And cost hundreds of millions of dollars, which costs more because it's
tens of millions of dollars. Right. I mean, the average new drug clinical trial has a minimum lifespan run of 7 to 8 years.
Yeah, I mean, there's no way that this would be feasible by November or actually ever, because who pays for clinical trials too are manufacturers, and they're not going to make a product that is already not profitable that people don't want. And that is the goal of this executive order. And that is, if parents take anything from it, that is what they should take from it. This thing is lying to you to make you doubt the combined MMR vaccine. And, when people get in a situation where they're like, well, the MMR, I guess, is okay. Like, people are saying that, and there's measles everywhere, but the president is saying that this is terrible and I should be waiting for these monovalents. What should I do? Chances are most people are not going to go get a vaccine. In the face of doubt, people are going to stay home. And so one thing I tell parents is that the thing that they can do first and foremost is to make sure their own kids and their own families are up to date on the schedule. That's the best way to protect your family. But also when their friends have questions about this stuff, I don't know, I think maybe I should wait for these single shots. I think it's important to let people know these single shots are never coming and you don't actually want them, because it just means more shots for your baby. Not the amount in a soda bottle, but still it's 6 shots instead of 2.
And then when you start adding in, let's just say all of this does come to fruition, right? You're asking families to take more days off of work, to take their kids to more doctor's appointments, right? And exposing these kids to more trauma with already a needle that they're not going to want to take. Okay. And then you're asking these parents to have additional copays, more out-of-pocket expenses. It's not even I mean, there's a reason why the trivalency of the vaccine was so. And if you notice, Angie, they don't do this with the flu vaccines. And remember, so when you get a flu vaccine, everybody, you're not getting just the season's flu vaccine. You're getting ones that they have already given, plus additional potential strains that might mutate for that season. So when you get the recombinant flu vaccine or Combavax, that's like, I think it's like anywhere between 4 to 7 different strains.
No, it's actually, it depends on which vaccine formulation you're getting. They usually do, most flu vaccines usually only have the new strains for the new season, because those strains will actually boost your immunity from last year too. There's usually enough.
There was something else I was thinking of that's multi-strain like
yeah, it depends really on the type of vaccine. You're talking about recombinant vaccines. Still to this day, most of the flu vaccines that are actually administered are inactivated vaccines. So they're made with whole virus. And for those ones, they're a lot harder to grow. They grow in eggs a lot of the time. And so they don't want to make more viruses than they have to, because they have to actually make.
So the problem with that now is the eggs have salmonella because they're not being inspected by the FDA.
Well,
right?
the salmonella and cyclospora. So one thing,
you can't have jalapenos, you can't have eggs, you can't have peppers,
can't have lettuce, but those are the things that that RFK is trying to promote through his new cooking show that he wants to do. Instead of public health, he wants to do a cooking show for food that you can't buy because it's all diseased. But I hear rotting bear carcasses are still okay.
They're okay. Raccoon penises as well. And the price of beef's going through the roof. So we got to get creative with our protein sources here. I mean, this is something that I've really also been taking a look at. Like with one of the things I'm working on for the Save America movement as the science chair, I don't just like talk about science. I'm actually doing some science. And one of my areas of expertise is using AI and machine learning classification models to predict disease outcome for different viral infections. So I'm actually kind of trying to do that at a national scale, using some standard epidemiological approaches and trying to put other types of data in. And one of the things I am looking at is how funding cuts have impacted things like food safety inspections. And oh, guess what? Like, they've lost FDA and USDA food safety inspectors in all of the states that currently have an ongoing cyclospora outbreak.
Yep.
I tried to get Steve and Dean to show data when I went on their show like a few weeks ago, but they didn't. They didn't want to see my graphs.
If you've got graphs you want to share, I'll put them up. I love putting up graphs. Like, if you want to come back again too, and just basically have a show of graphs that you can talk over and talk about. Eric and I have done that a couple times with things that he's put together, and I think they're important because seeing the data is really powerful, and seeing what it actually means is really important, especially for parents. And like, I'm a parent and I've got 2 kids and I don't want my children getting sick. We just got health care back for my children because my wife finally is in a job that offers health care, and we can now ensure that our kids are safe. But what do you say to parents, and how do you help parents, or even just anybody, but how to specifically for parents, because that's a lot of what I talk about is like in terms of like health for our kids and stuff, is how do you ensure that we get good information? And what are you doing with, say, the Save America movement and your role there as the science chair to ensure that that type of information is really well promoted and seen for others?
I'm always trying to do more in that department. So I am just one person, which is one reason why I'm really glad to work with the Save America movement. I also, full disclosure, the executive director of the Save America movement, who co-founded it with Steve Schmidt, is my very, very good friend from college. So that was originally how I got involved in it. And because it's my friend, I don't want to look bad in front of her. So I really wanted to do stuff with Sam that would make an impact. And that means both doing stuff like this, and I would love to come on and have a graph show. I would love actually for us to take a problem that we haven't really thought about as a public health problem, maybe necessarily. One example, now it started off as a public health problem. I gave a talk at the Vaccine Congress last year about the effect of US policy, and I tried to estimate how many cases of vaccine preventable diseases we'd have in the US within the next 10 years. And just using standard epi tools, it was shocking to me. I mean, we're talking over 3 million measles cases cumulatively over the next 10 years. And that, to me, is just mind-blowing and insane. And that's the kind of thing that I think parents really maybe would think about a lot, just because, you know, those kind of numbers are really scary, I think, for a lot of people. But then I started thinking, how does this affect other things that we're facing as a society right now? And I started thinking about this in the context of the measles outbreak that occurred at the Dilley Detention Center in Texas, where ICE is taking a lot of kids, and they are not offering them measles vaccines. They're not offering them any kind of medical care. How does this affect the community around those facilities? So it's questions like that, where it's like, we're talking about measles and immunization and the things that parents are worried about, but what are some ways that this affects our communities in other ways that we don't necessarily see, but that are really important? I'm also looking at the effect of infectious disease outbreaks on elections and election turnout. And I think that's going to be very important too, because one thing that you always talk about, using the E word, whatever, but what was your euphemism?
Gene pool management.
Gene pool management. I mean, I think that is one of the points of gene pool management. It's so that we won't show up to participate in our democracy. We won't fight back when people try to take it away from us. And I think that showing the data to people is really important. So that's the big thing I'm trying to do with the Save America movement. Also, you talked about this just now in Arkansas. You know, it's a state where a lot of people are losing health care, where a lot of people don't have access to the services that they need. What can Save America movement do to partner with other organizations or even local public health organizations to provide better access to people, to help them get better information? The information landscape right now is a terrible place. It's terrible for people who just want basic information, because like I said, I don't wholeheartedly recommend the CDC's website for vaccine information. I definitely think people should go to places like the Vaccine Integrity Project. They should go to the American Academy of Pediatrics, the Infectious Diseases Society of America. These professional societies do have this information. But it's hard when you're giving people a grab bag of professional societies that they should go look at. It's easier if they just hear it from somebody like, you know, Angie, who didn't get a chance to finish putting her TV makeup on because Saskatchewan time. I feel like respond to that better. So that's what I'm trying to also do for the Save America movement, is just tell people, like, answer their questions. So next Tuesday, actually, great opportunity to promote stuff. I'm not very good at this. Anita Patel, who is a double board certified critical care pediatrician and has been really, really outspoken about especially children in ICE detention, and I are going to do a Q&A, a live Q&A at 12 Eastern time on Tuesday through Save America Movement's channel and our own, answering people's questions about the executive order and about vaccines.
I love that.
And just for everybody's refreshing, Kavita Patel was actually part of the Biden administration's health policy.
No, this is Anita Patel.
Oh, Anita Patel. I thought it was
I do know Kavita too, but this is Anita Patel.
Okay, so
you can find her.
That's two massive errors I've made on this show.
No worries.
The first one was showing up with Angie, thinking that I was going to get a word in today. But
I mean, I'm glad you texted and you're like, "We're in studio. Where are you?" And I was like, "Shit, I was about to put on my foundation."
So, like, there's a lot of, like, when we talk about public health policy, and everybody kind of talks about public health from a medical standpoint, right? But what I want to try to impress upon everybody who's watching is it's not just about the medical services that you're getting. It's also the vaccine services, the public health epidemiology analyses. It's the governance of surveillance data that's missing. You know, it's like we all had this. We all saw the news with the outbreak of the measles in certain parts of the country, in Texas and South Carolina and Eastern Virginia, and all of these things did not exist 2 years ago.
No, and
right?
Eric, I mean, this is a really good point. A lot of people keep saying, "Oh, well, it's not just because of Kennedy. Like this happened before." And they're right. Nick, you mentioned that the way that vaccination uptake is measured by the CDC and public health organizations is by how many kindergartners have been vaccinated before they start school. And so that's why they're always talking about like the number of kindergartners who are vaccinated. It has been falling steeply. And
Yeah.
of course, in places like Arkansas and red states, places that have less funding for education, places that have less funding for healthcare, all of those places, vaccine rates are going down for a variety of reasons. And some of them are not Robert F. Kennedy Jr.'s fault, but many of them are, because before he became the HHS secretary, he was America's most famous anti-vaxxer. And it is his relentless propaganda that he put out for decades, and I should add, made a very large amount of money on, is what has persuaded people that vaccines maybe are unsafe. Maybe they're not effective. If people start listening to what the anti-vaxxers say and thinking about it critically, they will realize that a lot of what they say contradicts itself. But a lot of times those messages are so tailored to hit a particular thing that one person wants to hear, because they're actually political messages and not health messages, that is what convinces people, I think, to not get vaccinated. And that is the role that Robert F. Kennedy Jr. is serving in this administration. It is to intentionally make more kids sicker by driving down the immunization rates.
And just for everybody reference, I mean, I know the answer, but I want everybody to hear this. What should be the national vaccination rates for, say, varicella, for measles, mumps, rubella, for influenza, across the board, when we're talking about immunity,
I mean,
and protecting society?
So these are all different vaccines. Now, the MMR works differently for measles than, say, the influenza vaccine. But the reason why people need to get the MMR vaccine is that it is 97% effective, but measles is the most contagious virus that we know of. You need to have 95% of the population or more vaccinated against measles to prevent measles outbreaks. So in all these places where it's like, oh, it's not that bad, it's only 92%. No, I mean, you're one case away from having that take off in your community. And that's why we're seeing the pattern of measles outbreaks that we're seeing now. It's because in these local clusters, these are community groups, and some of them are religious groups, some of them, and the Mennonite faith is not actually anti-vaccine, but in a particular part of this Mennonite community, they had a lot of issues with the government and government overreach. So that's why they were refusing vaccines. Other communities might have actual religious reasons to do it. Other people may just not know what to think, and so they're not going to go get vaccinated until they understand what's going on. But in those communities, those local centers, that's how measles outbreaks happen. It's not one big measles outbreak across the country. And that's why it's not going to be going away anytime soon, because as these groups swell and you get sort of a critical mass of kids that are susceptible, you're going to have a measles outbreak, then you're going to have immunity in that community, but it's going to move somewhere else because we just keep making more susceptible kids.
So for families who are looking or possibly planning to have children, how do you see this impacting them? Pregnancies. I know in Arkansas, there was an article that just came out saying that in almost every county of the state, you have to go out of county to get pregnancy care, to get an OBGYN, because there are so few left in our state. How do you see these types of like vaccine quote mandates? Because executive orders are not law. They're just a executive order saying this is what I want to have become law, or this is how I want it to be done, but it's not really law. But how do we help parents find the right resources and even find OBGYNs or pregnancy health? And how is this going to affect moms or soon to be moms or women who want to be mothers? How is this all going to affect them?
This is such a great question because, the past week or so, time is a flat circle. Did it happen 2 weeks ago? There was it was last week, but there was this misinformation that essentially the COVID vaccine caused 82% miscarriage rate in pregnant people who got it. And that's obviously untrue. I mean, if that happened, there would be no babies being born. We'd know it if 8 out of every 10 pregnant people we ever met had a spontaneous abortion or miscarriage. That's not something that you could cover up and hide, but it's a great example of how this type of misinformation spreads, because you have, Maria Bartiromo reporting it on Fox News and looking very serious, and, people will believe that. So I understand completely why pregnant people, especially those who can't access prenatal care or pregnancy care, or even any kind of reproductive health care, will have a lot of questions about that. One thing that I'm actually incredibly worried about is rubella virus, because in particular, I don't know, people haven't ever seen what a rubella epidemic looks like. That will cause massive spontaneous abortion in pregnant people. And it will cause babies that are born to mothers who have rubella virus to be born potentially with very severe intellectual and sensory disabilities. So it is a particular virus that has a big impact on pregnant people. But the problem is the vaccine is a live attenuated vaccine. So pregnant people cannot get the vaccine. You need to get vaccinated or get your titers checked before you get pregnant. And in a place where you have to go out of county to even get any kind of basic care, how are people going to even be aware of that? Because again, we haven't had major rubella epidemics in this country because just like measles, we eliminated it with vaccination. So I don't know the answer to this problem, Nick, because the healthcare access issue is one that is going to be extremely community specific. And this is going to be an extremely unsatisfying answer. But what can pregnant people do? Listen to people like us who are going to give them accurate information, get as much health care as they can, and we'll keep figuring out ways to do that. But also, this is my strong belief about everything. There's this trend now of we're going to befriend all the Maha people, and we need to listen to them, and we need to hear their concerns and understand where they're coming from. Okay, I'm down to do that. But guess what? I'm not that concerned with that. I'm not going to preach to the converted. I need to get the people who are on top of that movement the fuck out of their positions. And that's what I'm focusing on. And that's what I'm telling pregnant people and parents that I'm focusing on. I'll give you good information and I'll transfer you to people who have information about stuff that I don't know about, who you can rely upon. And I think our network of people are really committed to that, making sure people do have that good information. But in the meantime, I think it's on us, and by us, I mean people in the public health space, people who are fighting for democracy, to get these guys out of there.
And that's why elections matter, everybody.
Yes.
There you go. I want to circle back real quick to the measles thing with the Mennonite community. So if everybody remembers back, I believe it was, I think it was in February and in April, there was the 3-year-old and the 8-year-old, and they're both from the same county, and they both occurred in Texas. It was Gaines County, and there was a heavy Mennonite community, and that's the one we were referring to. But the other problem here, both Angie, Nick, and everybody watching, is that when you start having exceptions increase because states allow parents to do exemptions from the vaccines on religious reasons. We see this in New York State, in the Orthodox community. We see it in Gaines County with the Mennonite community, and just whatever it is. But the biggest thing for me is it's not in as much that the vaccination rates are going down as rapidly. It's the exception rates are going up exponentially. It went from 2.5% to 4.2% in under a year. I mean, that's like an 80% increase in exemptions, And that's, to me, is the bigger problem on messaging about the public health on the need to vaccinate. And that's, to me, that's the bigger number is, yes, we've seen the 95% herd immunity number that we want dropping to 92. And that's been a slow kind of chisel away over the last 10 years with the anti-vax movement, but the exemption rate has doubled in under a year. And that's more concerning as a healthcare provider.
Right.
Because now you've got people deliberately looking for reasons to not get it and then use religion or whatever as a meaningful purpose to not vaccinate their kids, which puts the entire community at risk. Remember, I think I even wrote this, I think, in one article on the measles outbreak, that one measles case in a high school can wipe out, or even an elementary school can wipe out the entire district in a week.
Yeah. I mean, measles is incredibly.
We're talking a whole district, not just one school, the whole district. So,
and I don't think that people recognize. I'm really worried about something else, and that is just the fact that school is starting again. Because I don't think people realize, so much of this stuff is at community level. You're talking about exemption rates, and exemptions oftentimes are determined by state law, and sometimes they are allowed by local laws as well. So if you have a community that ends up being very anti-vax and ends up having a significant number of people who are part of an anti-vax movement, you end up with more exemption laws, and then other people take advantage of those, or they avail themselves of those. And so this really it does become a community issue. Just like measles outbreaks happen in communities, they spread within communities like schools, and then they spread to other communities, but they are not, an even thing. This has to be dealt with at community level. And so again, Nick, to come back to, I'm so full of unsatisfying answers for parents, but I always have an answer.
I'm glad you really have answers though on this, even if they're unsatisfying. Having information and having answers is really important, because having knowledge is power, but focused knowledge is real power. And so I want to follow this, what we've been talking about, up with, we haven't even gotten to the full effects of what the big billionaire bullshit bill is going to do to the healthcare systems. We have not seen them.
The manipulation.
Yeah, the big bullshit bill that is going to that has already started decimating public health, but is going to further
next year
decimate after the election. And most of the major cuts are coming after the midterm elections, because Republicans wanted to sneak them in after Democrats came into power, because they knew they were going to lose a year ago to the Democrats. And so they're going to find a way to blame it on Democrats, because the big bullshit bill does not come into effect until 2027. How are you helping approach this to spread the right information and not disinform or misinform people on what's going on? How are you using the Save America movement, your platforms, other professionals like Doc Eric, and others in the fields to spread the right type of information to people, so that they know, one, there's more damage coming, and two, who's actually responsible for that damage?
Yeah, I'm so glad you asked this, because now this gives me a chance to talk about all the science stuff I get to show off. So I'm already on.
This is why I brought you on the show.
I'm already on top of it.
Finally, it took 43 minutes. We finally got here.
I mean, trying to not misinform people, that's just my training as a scientist. And I bet Eric is similar. And I know from reading his material that he is. Like, cite your evidence, cite your sources. Like, don't just tell people like, this is the way it is. Like, actually give people something, also give them something they can access. Sometimes that's like a peer-reviewed published paper, and sometimes that's a table with the data source cited. Like, you got to not only give people good information, but you have to give it to them in a way that they're actually going to want to absorb it and like take it in and engage with it. So I really do work a lot on that. But as part of this big AI project, so I kind of started thinking about all of this stuff as in line with what I do. So my research studies the role of the host in determining how sick basically you get if you get infected with one of these emerging viruses. So Ebola, flu, whatever. What happens is the virus infects you, but it doesn't just make you sick by killing your cells. It elicits all these different responses, inflammatory responses, antiviral responses, immune responses, all sorts of things, changes your metabolism. This is probably where long COVID comes from, is essentially the virus is reprogramming the host. And that can be residual. There are a lot of post-viral infection syndromes, for example. we don't really know a lot about it. But boy, does this seem like something that's just perfect for my area of expertise, because what I do is use AI to start untangling these really complicated problems. And I do it usually with gene expression sequence data. But why can't I do that with government data about the US? And so I'm studying the pathogenesis of fascism as well as the pathogenesis of emerging viruses. And as part of that, my colleague at the Save America movement, Jonathan Wilson Hartgrove, approached me and asked if there were ways that we could apply statistical and Bayesian modeling techniques to tracking policy. And so the policy that he would like to track is the One Big Beautiful Bill Act. And what he specifically would like to track is its impact on healthcare. So I have downloaded all of that data from CMS, as well as a lot of other data that will be very relevant in terms of OMB expenditures, in terms of different block grants to states and different programs that funds. And I'm going to be trying to actually quantify policy impacts going forward to the point where perhaps we could even forecast some of those impacts more accurately. So I don't know if it's going to work. And this is a totally new sort of direction for me to go in scientifically. But my husband changed careers from a proteomics guy to a data scientist a couple of years ago. And his attitude about it was, it's all the same math, it's just different data. So I'm confident that, I'm going to at least find some interesting stuff, even if I can't solve the whole problem with AI and machine learning. But stay tuned is the short answer to that question, because I will actually hopefully have some numbers of those policy impacts specifically on the healthcare system for individual states, all the way down to individual counties.
Oh, that's fantastic. I think that's information like that. It could and will be probably a lifesaver to many people.
What I'm hoping is that I'll be able to distribute it to individual communities. Sorry, I should have silenced my phone. I will be able to, we'll be able to actually send this out to individual communities so people can know like which issues are going to affect them and impact their lives the absolute most.
How do you, because there's a lot of distrust with AI. And I understand, like, I have a lot of distrust with certain aspects of AI. I use AI myself for some things. It's a really great assistant and tool that can be used to augment your what you're doing, your research, the coding and development and different things. How are you going to ensure that people trust the data that you're going to be providing out of this, because knowing that they'll know that there is an AI model that has supported the creation of it? How do you build trust for that information so people don't just dismiss it as AI drivel or nonsense?
This is something that I've realized I need to start communicating to people better. There are so many different ways to use AI. And when I say, I'm using AI to predict the outcome of a viral infection, I'm not like, hey, Claude, what's going to happen to this patient? Like, I don't even use generative AI to actually do any kind of predictive work. It's standard Bayesian. I mean, technically it is AI, but it's not generative. Machine learning classification methods and different types of Bayesian modeling methods. These are standard statistical approaches. Where AI comes into the equation is, I used to have a bioinformatician writing code for me, and now I have my extremely toxic and manipulative collaborator, Claude. And so AI is actually not doing the predictions. It's still me who is tracking this. AI is my slave and is writing code for me.
I think that's a great differentiator in what you're talking about. And to me, that builds trust as someone who uses AI as a tool, as what it's supposed to be, is it augments my work capabilities and helps me do more in less time. But it doesn't do the math for you. It's you doing the math. It's you doing the modeling. And I think that's really important to keep that differentiation and distinguisher, because there is a lot of distrust with AI. But there's less distrust with standard statistical modeling.
Yeah, and I mean, the thing is, it's like any type of science experiment. Before we had AI, we used to talk about p-hacking, which is the process of manipulating your statistical test so that the outcome of that, which is called a p-value, is lower than 0.05, which is sort of the default standard for statistical significance. So if you tweak one of these parameters here, and then all of a sudden your p-value is 0.049, ooh, look, it's a statistically significant result, but that's called p-hacking. And that's, a no-no, because it's actually massaging and manipulating your data to make it say something that it actually doesn't. One thing that I really try to communicate to people a lot, and this has to do with my involvement in all of the COVID origins stuff, the lies that people are saying about Tony Fauci is that he said stuff privately that he disagreed with in public, or he later said something different to the press than he was saying to Francis Collins. And they've said this about me and a lot of my collaborators too, based on our old emails. That's the reality of the scientific method. We get new information, and sometimes it disproves what we thought before, and we change our minds. And I'm just really, really trying to communicate this to people, that it's actually normal to say, this was wrong, we need to do it this way. And with AI, I have to keep Claude. I spend so much time keeping Claude from doing its own modeling, from not running controls, from not reading the data files before it sticks them in the model that I've told it to run. I mean, I have to keep my foot on this thing's proverbial neck that doesn't exist. And it's really challenging. But because I am a scientist, and because professionally I have standards for reporting my results, my intention is that as I share these things, people will have full access to the data sources. I'm using government data that's publicly available, so it's not secret. And I will make all of my methods freely available. That's the only thing that I find Claude useful for writing. Write what you did, Claude. Include all of the mistakes that you made.
I love that. I really appreciate that you're as a scientist, you're putting the effort in to ensure that the data, and that you are not trying to massage or manipulate it into the results that you want, but you're actually just providing the data, because that's the important aspect, is the data and what does it actually mean, and how do we get something useful out of this data. So thank you for putting those efforts out there, because this information is going to save lives. It's going to help parents save their children's lives. It's going to help parents save their own lives. It's going to help us be healthier. And I appreciate the efforts that you're putting in.
That's all I want. It's really heavy living with the knowledge of what's going to happen because of the immunization stuff alone. And then I can scare the shit out of everybody by talking about what happens if H5N1 makes the jump to becoming human to human transmissible. I mean, we are looking at potential just absolute disaster, but I think we're looking at disaster sooner than that with stuff that's a lot more routine. What's going to happen if there is an influenza outbreak in a small community that has had their health resources cut, where there's already a measles outbreak? And Eric can speak to this more than me, since he actually treats patients. But there's only so much equipment.
Yeah, which part of shit and show do you want to form into one sentence?
Right. I mean, it's a huge risk to that community's health and their children. It's also a huge national security risk, because what happens when our health systems start failing around the country?
And that's the other part that most people don't understand. I wrote on this too when Casey Means was going through her confirmation hearings as the Surgeon General, was that our public health policy is one of our national security pillars. Like, when you start eroding public health and you make the population susceptible to a airborne biological weapon in the form of a disease or a viral infection that can spread through the community and spread through a population, now you don't have you don't even have a community epidemic, you have a countrywide pandemic on top of the potential of holy shit moment. And we don't have a pandemic task force. Trump wiped it out again. He did it in 2016 when he got elected, after he wiped out Obama's pandemic task force, which is why Zika virus did not come to the United States, and Ebola the first time around did not come to the United States.
Well, it did, but it didn't spread.
Yeah, but it wasn't spreading. But in a country like we are today, where all it takes is one person to hop on an aluminum sardine can and fly from rural Wyoming to major Denver International Airport and start spreading a disease, it doesn't take much. And like, from a public health perspective, it's vaccines and hand washing. It doesn't get much more so. And if you're sick, stay home. Like, I understand you have to go to work and you need to make money, but if you are legitimately sick and you're prodromal and you're feverish and you're sweating, you're seeding virus or bacteria. You are a threat to your coworkers and other people. And this is where kind of common sense needs to play in, everybody. Like, if you're just that sick, stay home. If you're running a high-grade fever, that's usually a bacterial infection, not viral. Most viral infections, and it depends, but the majority of common viruses, influenza, rhinovirus, are going to be low-grade fevers, except in children, where they're going to run higher, And it's not uncommon for infants and toddlers to run 102, 103, 104 when they have a few, because they don't have a phenomenal immune response yet. So this is why you talk to your family physicians, you talk to your internists, you talk to your pediatricians. You are referencing specialty websites like the American Academy of Pediatrics, the Infectious Disease Society of America, Rasmussen reports.
It's Rasmussen, but everybody calls it Rasmussen, so it's fine. But that's the way the bad Rasmussens pronounce it that way.
Right, the bad
Rasmussen retorts.
But this is where, as patients, and we're all patients, like, we all have seen a physician one time in the last 3 to 5 years. Okay, it makes you a patient. You have a relationship with your physicians. It's okay to ask questions. I want you to ask me the questions, because the only dumb question is the one you don't ask. And if I don't know the answer, I will get you the answer. At least that's what good physicians do, is they don't want you leaving the office with more questions than answers. And if you're getting that, and then the other thing that I want to just touch upon is, we were talking about like the Medicaid cuts that are going to come next year. Think about how many rural hospitals have closed in the last 2 years because of the funding cuts in this administration. It's brutal. I have Substack creator friends of mine on here who live in rural parts of the country where they have to drive an hour just to go get medical care. That's not acceptable. And when you start tacking on CDC cuts, FDA cuts, NIH cuts, Medicare cuts, Medicaid cuts.
And they're going to try to sneak the OMB stuff back in.
Oh, absolutely they are. Especially in the lame duck session. I expect the SAVE Act to pass. They're going to sneak that shit through. They're going to sneak in probably OMB policy issues. And don't forget, everybody, we're still going through rulemaking. Thank God that we have a rulemaking process in this country, because it's the only thing that has stopped this administration from really putting through a lot of the shit that they wanted to put through in Project 2025.
And that's why this was an executive order, by the way, because they can't get around the rulemaking requirements.
Can't get around the rulemaking. And the biggest one right now, that's the three things that are sitting right now at Medicare and HHS, is the outpatient prospective payment system, the inpatient prospective payment system, and the physician fee one, which they are just wiping out the physicians. Certain specialties go up, some go down, but for the most part, ENTs, dermatology, podiatry, I think there's one other one that are getting massively cut.
Yeah, and I think this is a good point, Eric, to say also that for the people watching who might be like, oh, Eric just wants to get paid more. It's like the people who say that, oh, she just wants more of that Fauci grant money, like to just make it rain on her lab. And no, like, people actually, things cost money, including like salaries and like our mortgage payments and stuff. So like, people need to get paid a living wage, and that includes doctors. So I do want people to understand that this is not just Eric sad because he's going to get a little bit of a pay cut. This makes it impossible for people to be doctors financially.
Let me put this in perspective for everybody. So when we look at hospitals, hospice, home health, they statutorily under the Social Security Act get a 2.4% raise every fiscal year. Okay. Physicians haven't gotten that. Since 2001, physicians have not been adjusted for inflation. If we were, there's a thing called the conversion factor. So every procedure code, even an office visit, has a specific value unit that gets multiplied by that conversion factor, and that equates out to what the fee schedule is. So, for example, an office visit might have a work unit of, say, like 3.5. So you multiply that by the conversion factor. So this year it's $33.65. If we adjusted it for inflation, everybody, and keep in mind that physicians have not had a raise in the conversion factor since 2001. If we adjust the conversion factor for inflation, my conversion rate based on the work value should be at $65.16. I'm getting 33 today. So don't complain about the physicians. It's not the physicians making all the money. It's the hospitals. It's the pharma companies. It's the CEOs of the health insurance companies. And everybody else that has their hand in the cookie jar on the Part A hospital facility side of medicine. It's not the Part B outpatient stuff. It's not your community level physician. It's all going to the facility. And this administration shifted a lot of money back to the hospitals. So thank you to the American Hospital Association and their lobby group, and the American Pharmaceutical Association and their lobby group for buying Mar-a-Lago memberships and shifting a lot of money back into the facility. And they cut NIH, they cut CDC. There is literally zero funding now for independent research at university level labs, where new drugs, new devices, innovation, we have no innovation going on right now. From a medical laboratory development standpoint, unless there was stuff that was already in the pipeline, but there is literally going to be zero innovation. This president and this administration have killed the scientific innovation that is what allowed this country to develop the robotic prosthetics for Nick's fellow veterans at the VA. That money's gone.
VA's
Gene
getting cut
pool
too.
management.
And the VA's getting whacked.
The VA's getting nailed.
Yeah, they are. I lost when the big beautiful bill first happened. I lost my provider of multiple years, and I am thankful that I had finished going through the diagnoses and screening process for fibromyalgia, and that I had been diagnosed before I lost my provider, because my new one doesn't give shit. My new one doesn't care because they can't, because they're overburdened, because my VA is at a quarter staff.
Yep.
And it's going to get worse. And
this is genocidal eugenics.
Yes.
No, I mean,
gene pool management, genocide in slow motion.
It's what they've done. I mean, back in October when Russell Vogt implemented the reductions in force at the CDC, I mean, that was the point when I was like, I don't think the agency is going to actually be able to function at all. And that's what's happening across.
That's the plan.
Everywhere. I mean, at the VA, right down to the level of, and it's going to be the same thing with Medicare providers, with Medicaid providers. It's the same thing at NIH, the CDC.
Paralyze the agency so it,
you know why?
Paralyze the agency. Yeah, you paralyze the agency so it can't function. Thereby, the government has no other alternative than to privatize the agency.
Right. And guess who's going to be first in line for all of those private contracts? Oh, right. The people who are all buying memberships to Mar-a-Lago and whatnot. I mean, it's
the billionaire class.
Yeah. Yep. And it's, I mean, we all
we didn't even talk about like the thing. If everybody notices, here's the other thing I was going to bring up. We were talking about FDA and food supply, and I forgot to make this comment earlier, but how many times now have you gone to the grocery store and you're seeing more seedless fruit and vegetables? Right.
Well, I live in Canada, so I can't.
Well, yeah, so you have that fine. But like, I mean, the issue of continuing to have lab grown fruit with no seeds means that
they're not lab grown though.
Like, well,
they're just hybrids that don't produce seeds.
They're hybrids, but those, if you're not getting the seeds, you can't plant your own garden.
Well, yeah, but do you get seeds from like grocery store watermelons to like plant?
No.
But I live in
No,
Saskatoon, so I like don't grow a lot of vegetables.
That's because you're in that's like the the caribou tundra up
You
there.
should see this. I have you see that? It's like Tuscany out there. I got some Canadian grapes that can survive -40 temperatures. I was like,
Nice.
my neighbor, who I don't like, has a bunch of this tacky Virginia creeper that everybody likes here. So I got grapes, and I'm like an Italian person. This is my villa.
Well,
prairies.
I love it. Well, we are at the top of our hour, just a little bit over. And Angie, I want to give you a moment here to be able to promote your work, and also to just again thank you for being here, being on with us, coming to talk with us. And I'd love to have you back for more, and bring all the graphs you want. Send them to me and Eric, and I will put up all the graphs that you want.
Make more room for the graphs if I do this.
Yeah, we'll make all the room for the graphs so that they can all be up, because those are amazing. So please, I'm going to put up your QR code here, and then promote yourself and how people can find you and the work that you're doing.
Oh, awesome. Thank you so much, Nick. So yeah, so in addition to being the science chair for the Save America movement, and you can always follow them and get back to me that way. I'm at Rasmussen Retorts on Substack, rasmussenretorts.substack.com. Rasmussen has no ass in it. Rasmussen, and it's SEN, the Norwegian way, not SON, the Swedish way. Anyways, that's where you can find me. Stay tuned and subscribe to me. I guess I'm really bad at this part. But please do subscribe to me, because I am building this large model that we can use to ask all sorts of interesting questions, using my expertise at studying viral pathogenesis to study the pathogenesis of the disease that is afflicting our society. I am able to answer specific questions, and I will be doing more Substack lives. I used to have my own like sort of daily Substack live show, but it was too much work and I just don't have it in me right now. So I'm kind of trying to rethink about how to do that most effectively. But you can see me on Tuesday on the Save America Movement's channel, or at Rasmussen Retorts with Dr. Anita Patel, answering all of your vaccine questions at 12 noon.
Thank you, Doc Angie.
Thank you, Nick. And thank you, Eric, for introducing us and inviting me on. This has been a lot of fun.
So for those of you that have seen my last show on Diogenes, because I will be replaced by Dr. Angie in the near future. So you guys can reach me here on Substack at Dr. Eric Lullove, at Dr. Lullove on Substack. You can also find me through Blue Ant Media with my writings and my posting through Blue Ant Media. Again, I don't want to take anything less from our phenomenal guest today, who is just A+ spectacular. And I'm so glad that I thought of the idea to have you come on today, because we've been talking about doing a show for a while, but I'm like, let's do this with Nick, because I know Nick will get
this is fantastic. Not that I don't want to discuss space and stuff. Well, we had talked about science shows and stuff, but I think that I love talking about science. But you know what? I also really love talking about science in this context, because I think it's so important right now. So,
and I really want to thank you again, and Doc Eric, I want to thank you too for always coming on and teaching me a whole bunch of stuff too. And finally, come support us here at Sick of the Shit Publications, so you can just suck less, because
I do this every week.
He does this every week. We've got our big water bottle of Just Suck Less with Sick of the Shit Publications.
I love it.
We're also doing a end of August heat wave sale here on the network with 50% off forever membership at Sick of the Shit Publications. We also have our shop, which is sickofthishshop.com, where you can get your water bottle, because it's hot and you need some water. So drink 40 ounces of water at a time, and tell those around you to just suck less, not so subtly, especially at airports. They are TSA compliant, so you can bring them through an airport. And if you see a member of ICE or some asshole who's at the airport, just turn your water bottle and remind them, just suck less. And if you need to, pour some water on those gloves that they're wearing, because you don't know if they're shock gloves nowadays.
Got a really good straw in here too.
It wouldn't surprise me if they used poorly insulated wiring for those.
Oh yeah, those shock gloves, they do have a failure point of water being.
Wasn't there a story of this? Somebody he like going at it his kid or something like
There,
that? Was there just a story that
there have been a couple stories that have come out, and we do need to talk about the ice or the shock gloves by compliant technologies. They have been used in prisons for a while now, and there is a case from 2024 that has alleged that the gloves were used inappropriately for anywhere between 19, like it was like 35 and 50 some odd or longer seconds being held on somebody, which helped lead to their death in the prison. There were two incidences in an Omaha school for disabilities, school for children with disabilities. There were two incidences where they're claiming that they're very low on the details on this right now on what happened in those schools, but there were two incidences at one Omaha school for special education for kids with disabilities and needs where the shock gloves were used. And if you are a resource officer who is using a shock glove on a child, you're abusing that child. If you
how is that not assault? I don't understand.
And if you are an adult who works in a school and is not stopping somebody from laying hands on a child like that, you are wrong. You're wrong. You're wrong. My mom is a retired school psychologist, a very slight woman. She never needed to use a freaking shock glove to get a child under control. And that's abuse. And we need to be talking about that. So that'll definitely be something we're going to be bringing up. I do have to go. I'm getting a call. I got another show I got to jump to.
All right.
So thank you so much for being with us. And as I always say, we're done being sick of this shit. So now we're doing this shit. Have a great one, y'all.
Everybody have a great day.
Thanks so